My name is Dr. Derek Enlander. I'm a physician in practice in a major medical center in New York City. Today I'm going to talk about COVID and its treatment. COVID-19 has dramatically changed the face of infections throughout the world. The pandemic that it has caused has affected nearly every country in the world. The virus is not affected by any antiviral that we know. So the treatment that is used is vaccination. Vaccination is not a new concept. Jenner, about 100 years ago, found that milkmaids who were exposed to cowpox were not susceptible to at that time, the devastating virus, smallpox. The cowpox inoculation that the milkmaids got from their cows protected them from the smallpox. Similarly, the virus actually, COVID-19, is protected by vaccination. The vaccine is a RNA vaccine. The messenger RNA of the vaccine produced by Pfizer and Moderna protects most patients. It has to be taken in several doses. The booster shot is taken as a third dose, which is taken approximately 6 months after the initial dose. Antibodies that are produced by the virus being attenuated or killed are actually seen in blood, and they can be tested. On occasions, the patient has a reinfection. The virus can actually reinfect patients even after inoculation. This is caused by, it's thought, a reinfection of a new strain or a mutation of the original virus. The original virus can mutate, and we have seen actually several mutations. The latest mutation is Omicron, and Omicron 1AB. The previous infections were caused by COVID-19 Delta. This seemed to actually be a more virulent virus and caused actually more devastating results. The Omicron virus seems to have spread more rapidly, but is less innocuous, is more innocuous. We at Immune Gamma Gear Up are a relatively new corporation that has produced a supplement to act in combination with the vaccination. The supplement K-Pressin is given in tablet form or capsule form 3 times a day. The capsules are taken immediately after inoculation for approximately 3 to 4 weeks. The K-Pressin is helpful in attenuating any secondary infection. We believe that the K-Pressin acts on the methylation cycle of the immune system, and the methylation cycle of the immune system is where the virus seems to react. K-Pressin does not have any side effects, and we actually seemingly have a method of an oral method of supplementing the vaccination. K-Pressin can be obtained without prescription. It is an over-the-counter capsule, and actually can be taken with water after meals 3 times a day. and can actually be obtained from most pharmacies or from the website attached to this report. Any questions about this should be addressed to Immune Gear Up Pharma, and we will be only too pleased to reply. Thank you very much. My name is Dr. Derek Enlander. I'm a physician in practice in a major hospital in New York City. For the past 30 years, I've been interested in various virus disease and various virus etiologies. This particular talk is about Covid-19 and its impact on society and how we actually plan to treat it. The Covid-19 is an RNA virus which affects a massive number of people throughout the world. It has killed, by estimate, several 100 million people. The endemic affects actually the population at large, from very young to very old. The pandemic is controlled at the moment by vaccination. Vaccination is not a new concept. It's an old concept, several hundred years old, and was developed by Jenner when he saw that milkmaids who were subjected to cowpox were not affected by the, at that time, endemic virus, smallpox. The vaccine that is used by Pfizer and Moderna is an mRNA, messenger RNA virus vaccination, which affects the immune system. The immune system is then affected by the vaccine, produces antibodies against the vaccination, and so protects the patient. The virus can mutate, unfortunately. This particular virus seems to actually mutate quite easily. At the moment we have several mutations. The original Covid-19 has actually produced an alpha, delta, and omicron mutation, and the mutation can actually affect patients across the spectrum. The mutation of the virus is a problem, because one virus mutation can actually affect a patient who has actually been affected by a separate mutation. We at Immune Gear Up have actually produced a supplement which can actually be used in combination with vaccination, and basically gives rise to increased immune response. This immune response actually is not accompanied by any secondary problem. We have not seen any problems with the K-Pressin. The K-Pressin supplement seems to actually act well in patients of all ages. The K-Pressin is taken orally 3 times a day, immediately after inoculation by the vaccination. The K-Pressin affects the patient by actually supplementing the methylation cycle of the immune system, the methylation cycle of the immune system is where we believe the COVID-19 affects the patient. K-Pressin is obtained either from a pharmacy or from this website. It is, as I said previously, taken 3 times a day, and one can take this for 2 to 3 weeks. If you have any questions about the supplement, we are only too pleased to answer your questions. You may actually ask the questions through the website by email, and we will let you respond. Thank you very much.